some of the websites to give you some examples, because everything works now. And some of you actually have found out already went to the website of this course, and so the website is being built at the moment, right? So this is I like it. Okay, the future of services. And here is where we see differences between culture and political visions. I definitely showed you that the UK, England, behaves completely different from other countries that I'm aware of. And to be honest, I have no idea about this part of the world. I don't know what's going on in China. I'm also not aware of what's going on in India, which is another very large country around here, or Indonesia. I'm sure that services are being provided, but I'm not sure people recognize it as services. I'm not sure governments recognize it, and I'm not sure whether there's design. So, but in my part of the world, I'm often a little bit sad because I'm not from the UK, it's not my country, and the UK provides me examples, right? And in my country, they don't behave that well. So, and neither do they in the US, where I'm frequently working, as Chen Ji knows. The services in the US is something you should find out for yourself. It's not a government issue. So, whatever. So, in my own culture, it's find attempts to invest in services. And that's what people sometimes do. Identify and describe results. What did actually change in the service? What are successes, what are failures, and what are problems? I think I would like you to consider this for your culture, which is mainly China and maybe Finland a little bit, because in Finland there's, I'm not sure, what's the situation in Finland? I never found out too much. Are they providing services by government?
Yes.
And are they aware these are services?
Well, I hope so.
Okay.
I was just thinking about like if there are some other branches of science or engineering that consider the same things, but it's like not this exactly the same.
Yeah, actually, Scandinavia used to have a good practice in services already long ago.
Yeah.
Right? And I'm amazed that I cannot find modern developments, but maybe I just didn't look at the right places. And what about China? Is services something that's officially recognized? I can tell you that the example of the company that you were talking about is an excellent example of an actual service, right? Which seems to be, it's a private enterprise, is Express. Is it private? I don't know. Okay. No, it's interesting to find out. Anyhow, it's there, right? Okay. So maybe during the week, be aware of this and find out in your culture what changed in services and what are successes and what are failures and what are problems that couldn't be solved yet. Okay. So. Part of the future of services is empowering people. So I would like to focus on that a little bit for a moment. Fair services should mean fair choice. Fair meaning that everybody has a chance. Not just the rich or the strong ones or the people who have lots of brains, but everybody, right? So now this is an example. Again, the example is from the UK, where at least they found out what the problems are. Probably you know what means a coronary artery bypass. It's a kind of operation to people's heart when you get some kind of a heart attack, and then there is a surgery to improve the situation of people's hearts so that they can live in an acceptable way. Now, this operation, let me say this heart operation following a heart attack, is 30% lower in the lowest socio-economic group than in the highest. The lowest being the people who earn very small amount of money. And the highest is people who earn a lot of money, right? Now, people who very low amount of money, they get 30% less of these operations after a heart attack in the UK, right? This is 2005, by the way, right? So, and they are aware and they try to improve, but it's an issue for service design. We could see here, even though the operations can be performed, the technology is there, the doctors is there, the knowledge is there, and officially everybody has the right to get an operation when needed. In practice, in the poorest group, the people with the lowest income, they get 30% less operations after a heart attack than in the highest group. So this is a problem that should be solved. And by the way, these are the UK, the official ministry resources in the UK know about it and tell the UK we should change it. So they are aware. They didn't change it yet, but at least they are aware of it, right? And so hip replacement. So people of old age, they have frequently they break the hip at this location here, because their bones get fragile, and when they step. Take the stairs and they make a wrong step, they can just break their hips, and this won't heal. So people need some kind of an operation, this hip replacement where they put an artificial part in your hip, right? I think they do this in China as well normally. It's 20% lower in the lowest socio-economic class again. So people who have a very low income get 20% less operations, despite they need more of them because they have a bigger chance to fall from the stairs, because they live in houses that are not accommodated. People who are rich enough live in houses where they have either an elevator or healthy stairs and so on. But people in the poorest part of the country, they have the higher risk and the less chance of an operation. So this is things that need to be checked. And here you see income. So this is income less than 3,000. This is income over 25, 52,000 pounds sterling. This should translate in about $70,000 and about $4,000. And you see the access to health services in relation to income. See, the lower the income, the less access to health services. Even though officially everybody has the same rights, in practice it doesn't work. Not because people are not allowed, but because people in a way don't find the services. They don't find a way to ask. Right? Because officially the politics has already decided everybody has the right. But people who earn less money, they just don't find the way. They are not aware, they cannot find the information, they are anxious, they are too shy to ask maybe. Okay. Now, in the UK they are talking about personalizing services. Personalizing means that you make the service to the needs of the individual citizen. Tailored, we call it. So it's tailor-made to the individual people, right? So in the UK, the next phase of reform is that services need to be personalized according to the needs and preferences. And this means, for instance, that poor people who don't understand the information get the information in the way they understand, in a simple language. People who are living too far from the health service get an opportunity to contact the health service without doing a lot of travel. So even if you are living in the countryside, they should have a chance to talk to a doctor easily, not having to travel so much. So this we call personalizing. So adjusting the service to your own needs and your own circumstances. Empowering all people to shape their lives could mean personalized learning or a patient choice in healthcare. So personalized learning means that high quality teaching responsive to the different ways students achieve their best. So personalized learning could be that people who have learning difficulties could go to special schools where they could take care of. So for instance, some people are not very good in reading. In my country we have lots of people who cannot read, and then we have the opportunity to have in your computer a system that translates the text and speaks it to the earphones. So if you cannot read from the screen, the text will be read by your computer. And now in certain schools it's allowed for children to either read the book or have the book in their computer and have it spoken to them. So this is personalized learning, right? And assessment for learning is also something. So if somebody has problems reading and writing, it's not fair to have examinations only by reading and writing. Maybe you could also allow people to listen and to speak to the machine, right? So, and the same is for healthcare. Like an expert patient program could enable patients to gain the skills needed to manage their own conditions. So you could help the patients to be experts on their own case, to understand their own illness, to understand their own medication, to understand the way they are treated, so that they can better, well, be treated because they understand themselves. And in certain cases we even have personal budget. By the way, this is also now in my country, in the Netherlands. A personal budget meaning if I have a certain type of illness, the government provides me with a certain amount of money that can be used for either visit the doctor or get medicine from a pharmacist or get somebody to help me at home in doing certain jobs. So it's not money that I can use for anything. I cannot go to the cinema with that money or go to a nice restaurant, but the money is dedicated for medical help. And I can decide for myself, I prefer to go to the doctor or I prefer to stay at home and have the nurse come to my home to treat me, right? And I have a budget based on my illness, okay? So, this is political statement, right? So this is, in some countries they made a decision, and actually the personal budget is now a decision also in my country. But then there's the need to manage the risk, because there's costs. If I am entitled to have so much medical support, I cost a lot of money, and so there's acceptance, because sometimes public says, hey, this is easy, this guy is ill, and now he gets a lot of money just for nothing, which, well, you could say the person get the money in order to be as healthy as possible, but some people could maybe understand it in a different way. So you should always consider the cost, you should consider the regulation, that indeed everyone has access to the services, to the education, to the health, and you should make people understand that it's acceptable to have this type of services. So it's balancing rights and responsibilities. Ensure that citizens, so everybody, recognizes the costs of the services they receive. Right? So people should understand they get services for their education, for their health care, and they should understand it costs so much money, so they should deal carefully with the services they get. Right? And then citizens could be encouraged to make responsible decisions about the use of services. So this could mean that you only go to the doctor if you really need, not to just have a talk or a chat, right? Because if it's free for you to go to the doctor, you could decide that you like the doctor and you could go there every week just for a chat. And this would cost maybe so much money that other people would not have a chance. So people could be responsible and make responsible decisions to just use the services when they need it. Right? And then everybody could also understand that people use the services. And there could be healthcare consultation, so some kind of a broker. So somebody who can advise you, well, in your case I should just stay in bed for a day, or in your case I should immediately go to the doctor. And even if citizens don't pay for treatment, the information alone may help them to understand. So provide information, which means again communicate to people, this is what we provide and this is why and this is how and this is what it costs. And then people understand to make use of it in a responsible way. Okay? Students, the same story. University students may believe their fees cover the entire cost of their courses, could be informed of the total cost. So, I mean, this is what the UK says again, but students know this is all for free. I'm not sure in China, I guess it's for free, or isn't it? You don't pay for going to university, or do you? Tell me. Don't you know? If you don't know, you don't pay, I guess.
Pay.
Sir?
Pay.
Do you pay for the university?
Yeah.
Okay. Right, so when I went to university I had to pay, but nowadays in my country students no longer pay. Everybody who finished high school can go to university for up to 5 years and don't pay tuition. If they didn't finish after 5 years, then they have to pay, by the way. But here you pay from the start. Yeah, okay. So this is a different situation, right? So in that case, you are already aware of the costs. And maybe in some cases the parents pay, but you are aware of the costs, right? I guess. Yeah. Okay.